guys. Some of you have had questions after the Vet TV series released a couple weeks ago about seeking mental health care, seeing a provider, especially if you have a security clearance. I have a couple of you that have dealt with that in the past and we've done really well with it. And so I wanted to answer that question for you, and not necessarily to set your mind at ease, but maybe to give you some pointers to walk you through it. When I was in federal service and I had my clearance, the polys were every 5 years and the re-up was only every 10, but that was an agency-specific polygraph examination every 5 years. So I'm not sure that your agency will require that, but for the TS, if I remember correctly, it's still at every 7 for the re-up, and then the poly is still every 5. So whatever that is for you, hopefully this process will be helpful. So we're looking at OMB number 32060005. The revision date is November of 2016, and it's titled Questionnaire for National Security Positions, and we're already at section 21, which is the psychological and emotional health portion, which is obviously the most concerning for most everyone. So it talks about, the first paragraphs say that it will not be held against you. Basically, it is not a single reason to revoke clearances: death of a loved one, grief, divorce, major injury, and it does include service in a military combat environment. Is not strong enough. They don't say the word strong. I'm going to say strong enough to eliminate anyone from their clearance. If you do more reading on other websites, it says that about 0.04% of you have a clearance that is rejected or denied solely for a mental health reason, but that's fairly complicated, so we're going to talk about that a little bit more. So 21A asks, has a court administrative agency ever issued an order declaring you mentally incompetent? And that's simply a yes or no. For all of you, it's going to be a no. I'm confident of that. 21A continues and it says complete the following if yes. So you'll have to list the dates and the orders and those types of appeals, if at all applicable. 21B asks if a court or administrative agency ever ordered you to consult with a mental health professional. A court order, and it does say an order by a military court, would be within the scope of the question and would require an affirmative response. So this could be anything from had stress on the job, major trauma on the job, and somehow got involved in the court system, and a judge or someone of that agency said that you needed to go see somebody. I don't believe that your supervisor simply making the recommendation would ever qualify. It specifically says court or administrative agency ever ordered you to consult, and that is very different. 21B continues. It just asks to complete the following. 21C, have you ever been hospitalized for a mental health condition? 99% of you will be able to say no to this. There are some of you, however, that have had to go through that experience for a variety of reasons. And if you say yes, you can provide an explanation. It does ask for voluntary versus involuntary. Voluntary is always, always, always better. If you make that decision yourself, by all means, you have the right to do that. It will always look better if it is voluntary versus involuntary. Talks about the date of entry and then the date of exit, and then we actually get to 21D, which is really, in my opinion, where the important stuff comes in, because most of you will say no to the prior 3 questions. Have you ever been diagnosed by a physician or other provider with a psychotic disorder, schizophrenia, schizoaffective disorder, delusional disorder, bipolar mood disorder, borderline personality, or antisocial personality disorder? Simply a yes or no. So let's talk diagnoses. A diagnosis is generally required when someone is using insurance as their payer. If you pay cash, your provider is not required or mandated to have such a diagnosis. So you can always take that into consideration. If you are working with a provider and you're concerned about the diagnosis, I would talk to them about that. I have a couple of you that I use things like unspecified mood disorder, depression due to known physiological condition, i.e., major back pain, fibromyalgia, cancer, those types of things that would elicit different types of mood symptoms. You can also tell your provider, look, I'm concerned about losing my clearance. What do I meet criteria for that we can utilize that won't penalize me? And a lot of them understand that that's a really big and important piece of your life, and that is basically your livelihood. And so if we can find something that you meet criteria for that's still in the realm that's applicable, that's maybe not on the as concerning list, that is still okay. The diagnosis is not nearly as important as the type of treatment that you receive. And 100% of the time, one person can meet 3, 4, or more diagnoses. So you may meet the depression diagnosis, but you may also meet generalized anxiety or mood disorder unspecified or post-traumatic stress. There can be all sorts of diagnoses that apply to one person. So one diagnosis does not have to be the end of the world, okay? Notice that PTSD is not on the list. I'm sure that's a concern for a lot of you, especially the combat veteran crowd, as it should be. I would be concerned about that as well. They don't list depression or anxiety or even neuroses either on that list. These are what they consider to be severe psychotic disorders and then a couple of personality disorders. So if we go to the next question, complete the following if you responded yes, and you can have an explanation of that diagnosis. You can also have more than one diagnosis at a time. And so you may have one diagnosis in 2014 and another in 2016. So please be sure to include those in the process. 21D, are you currently in treatment? Okay, so this is where we get a little bit more sticky. In the last 7 years, have there been any occasions when you did not consult with a medical professional before altering or discontinuing or failing to start a prescribed course of treatment for any of the listed diagnoses? So prescribed course of treatment could be anything from medications to treating insomnia, a CBT for insomnia program. It could also be heavy-duty trauma and therapy work. So this isn't like it's just medication adherence. This is also treatment adherence when it comes to therapy as a whole. Are you currently in treatment? Let's say you are, and let's click yes to that one. So we provide the name of the care professional providing such treatment, their address, telephone number, those types of things. And they do give you a few. So if you've seen somebody in the last 7 years, if you've seen more than one somebody's, list all of them. 21E is also really important. Do you have a mental health or mental health condition that substantially adversely affects your judgment, reliability, or trustworthiness, even if you are not experiencing such symptoms today? Okay, so here's the deal. We can all fake it till we make it, and we can deny having any type of issues. We can deny the diagnosis, the service connection, whatever you want to call that. But the real issues will come out in your behavior. And what I mean by that is you'll get pulled over after being at the bar one night, and the cop will say something to piss you off, and then you end up getting a DUI and an assault and battery against a police officer. Or you're in the middle of a divorce, your ex-wife is being quite miserable to you, and next thing you know, she has not paid the AT&T bill, which then ends up on your clearance report as well, and you go to teach her a lesson, verbally, of course, and she files a protective order against you. So you have to remember that it's not just about symptoms and nightmares or anxiety or anything else like that. They are looking at what is your behavior like as a result of the mental health condition. So in other words, if you can keep your shit together long enough to get through this and they don't notice anything like that, and somehow you're able to hide things like drinking or excessive spending or dangerous sexual encounters with strangers, then you'll be fine, basically. But that just means that you've skated by for another 3 to 5 years. Hope you don't screw up in between that time period. If you are seeing somebody, you will be much better off if you and your provider openly talk about the concern for losing your clearance, and that you have what I call a preventative letter in place before you are due for a polygraph or a clearance update, okay? So what does that even mean? A preventative letter, and first of all, anytime, if at all possible, you need to be seeing a provider who is off base, who is not within your agency, okay? Insurance is fine. There's a difference between progress notes and psychotherapy notes, and progress notes are very vague. Those go to the insurance company. Psychotherapy notes are the property of the therapist, and those are mine. No one can see those without a judge's court order. They are also mine to destroy at any time at which I choose, minus judge's court order. So know that your progress notes will be vague, the ones that go to the insurance company, or at least they should be. So when we're talking about a preventative letter, they already want to know your diagnosis, your treatment dates, who you see. And to that, I would say, ask your provider to talk about what you work on. Are we working on coping skills for insomnia? Are we working on coping skills for anxiety, to handle larger crowds, to have better communication with our spouse? Maybe even into how we lead people in the workplace. What are we doing that can help those around us understand things more clearly, and that we get our point across without being a total jackwagon about it? And so discuss those things with your provider. The more proactive you can be about this, the better off you will be. So know that you need to have an open and honest relationship with that provider, that you need to be really clear about the timelines. Do not wait till the day before to discuss this. And know that this is a document that they can actually keep on hand all the time and update as you go. If there's a question from leadership or a supervisor in between polygraph times, that they can provide that letter for you. I have done that in times past. And know that if you truly are at the end of your career and you do not want to deploy anymore, that you are okay with that part of your life being behind you, and you feel like it's unsafe to deploy, that you ask your provider to basically substantiate exactly what I just said, that you feel that it's unsafe for you to deploy and that you are voluntarily choosing not to do that anymore. I've had that happen as well. And that's okay. That's a perfectly fine request to make of whomever you are seeing. So that's 22E. I believe that that's the end of the form, but one thing that we definitely want to consider is the fact that they use the word adversely affects judgment, reliability, or trustworthiness. And so again, that goes back to our behavior, not necessarily the symptoms. And so if we're not showing up to work on time, if we're making unethical judgment calls, if we are using the government credit card for something that we shouldn't, or approving things that we shouldn't of others, and we're in that leadership position, what is that going to do to our security clearance? The worst thing that you could potentially do on this form is lie. Do not lie. If you have seen somebody, just tell them. It's not a big deal. It's going to be a big deal if you don't tell them, because then you have to backpedal and explain why you omitted that information. So please do yourself a favor and be very honest. Again, the most important things are: see somebody off base or outside of your agency, have an open discussion with that provider, someone who you can trust, keep that preventative letter ongoing so that you can update things, and be proactive. Tell them in advance, do not hide anything, and let them know that and this is my verbiage, in my opinion, in writing letters, that this treatment has helped you maintain resiliency, stability, and actually lends to long-term success. So in other words, we have better stamina than our counterparts who are not seeking treatment. We are taking care of our stuff before it blows up in our face. So that is question 21. Hopefully that was helpful for you. I know it's really nerve-wracking to even consider seeing a mental health professional, and thank you to that veteran who reached out and asked that question. I'm going to do another segment to this, but we will talk about what types of treatment are recommended and the best for those of you that do have a security clearance, because you have to remember that client-clinician confidentiality does not cover you for violating the disclosure clause in your security clearance. So we'll talk about that in the future, but I have successfully done treatment with guys who have had classified traumatic events, and it has worked very, very well. So we know that it can be done. So questions or comments, you can just hit the button below, or you can shoot me an email, office@laurenrich.net.